Hi, this is Dr. Perry. Today, we're going to talk about the Brazilian butt lift in thin patients. Everyone kind of thinks you have to have a lot of fat to be curvy, to have a Brazilian butt lift. But you can be curvy at 100 pounds, 130 pounds, 160 pounds, 200 pounds. All the curve is having the waist narrower than the ribs, narrower than the hips. I always hear patients saying that they were told they have to gain weight in order to do a Brazilian butt lift. This doesn't really work, and I just think it's a bad idea. And here's why it doesn't work. It doesn't work because fat cells don't replicate. If you gain weight, each of your fat cells gets bigger, but the number doesn't increase. Liposuction works because fat cells don't replicate. If you took one cell away, another one grew back, no liposuction would ever work. So that idea to gain weight for the surgery is kind of flawed. Why do I really not like it? Because one, you gain weight, you stretch the skin. Now the skin has less tone, you have stretch marks. It doesn't look as good. The other thing is, if you gain weight, you say you gain 20 pounds for the surgery. You gain the 20 pounds for the surgery, you transfer 100 big, very large fat cells, you put it in the buttocks, and then you lose the 20 pounds after. Now those cells are just going to shrink back to the same size they would have been. So in the end, you only had a temporary change in the buttocks and nothing permanent. So you just have to work with what you have. You don't always have to make the biggest buttocks in the world to look really good. So that's why I think, the Brazilian butt lift can be done in a thin person. The truth is, it's kind of like a breast augmentation. If you were 5'1", a 300cc implant is a D cup. If you're 6'1", you need a 600cc implant to be a D cup. So the same thing with doing the fat transfer in a small person. If you're 100 pounds, you don't need as much fat to make a change in the buttocks as if you're 200 pounds. So that's why it's a good procedure for thin patients also. Now remember, what we're doing with liposuction is we're just changing concentrations of fat cells. So essentially, when you do the liposuction, the problem area, you're just taking away fat cells from the problem area in order to get that area smoother and smaller. When you do the fat transfer, you're taking that same fat that was in the problem area and then putting it where you want that to go. So essentially, all you've done is really move the problem area from one place to the other. So that's kind of what we're doing when we're doing a liposuction on a thin patient. So, the big key, the big secret weapon for doing a liposuction on a small person or a thin person is you can make the waist tiny. And if you have a 2-inch waist, a 4-inch hips, you look outrageously curvy. You look like Betty Boop. If the waist is small enough, it doesn't matter how big the buttocks is. So that's kind of the idea of the Brazilian butt lift in a thin person. So you remember what we're doing with the liposuction is even the concentration of fat cells. So, this is an example here of a Brazilian butt lift in a thin person. Now, if you kind of see initially, she has a very straight figure. You don't really see the hips and the curves. But now, when we bring the waist in, see, if you kind of look at the waist here, the waist is actually larger than the diameter of the ribs. Now we have the waist smaller than the ribs, and now she has a nice, smooth, curvy figure. So there's not a lot of fat, but this is a curvy figure, and this one is not. And you can see what we've done with the hips. We've taken away this fat and then moved it here. So now instead of this concave area in the hips, now we have a convex area of the hips. This buttocks just looks better than the buttocks before. And now you see here, we have the flat spot in the bottom of the buttocks, and now we've filled out the buttocks to give more projection and a rounder, a better looking buttocks. So even though she's not a big person, she's very curvy and looks gorgeous. Doesn't have to have the biggest buttocks in the world to look great. It's just that she's got that nice smooth S curve. She's got the buttocks with the projection. The flat spot is taken care of. The hollow in the hips is gone. Instead of being concave, it's convex. Now we'll look at another patient. This again, we have a patient with a little bit of a wider waist and a flat spot in the hips. A flat spot in the hips, a little extra adipose in the abdomen. So after we brought the waist in, now we have that small, smooth, curvy figure. We added to the hips. Now we have a nice, smooth curve. Here she's just pretty much straight up and down. No real curve and no real shape. Now we've taken what little bit of fat she had. We took fat from the arms, the back, the inner thighs, the abdomen, but now we've added to that flat area in the hips. And now we have, instead of a flat line, a nice smooth curve. And it's just a good look. Here we have a box, and here we have a circle. So it's not like there's a lot of fat, but she has a nice little curvy figure. And then here's another example of a thin patient. And again, you can see she's straight up and down without much shape and much curve. This picture is only, these last two pictures were only a week after surgery. It's a nice, smooth, nice straight area without a curve. Now we bring the waist in, and now we have a nice curve. You can see the stomach, is as big as the buttocks. Now we have a flat stomach and more projection in the buttocks. It's just, instead of a straight line, now we have a curve. So it's a nice curvy figure without telling the people to gain weight. And we're taking somebody without any curve and creating curve. So these are 3 examples of a fat transfer in thin patients. And you can see that they have a nice curvy figure, nice shape of the buttocks, improved shape instead of flat lines, curves. Instead of the stomach being stronger than the buttocks, now the buttocks stronger than the stomach. So these are examples of how a thin person can have a Brazilian butt lift. So again, gaining weight for the surgery is not the right thing to do. You damage your skin. The other thing is that it's not permanent. If you gain weight for the surgery, you have to stay at that weight forever in order to keep the buttocks that size. Otherwise, the buttocks will shrink back to the same size it was. So Brazilian butt lifts do work in thin patients. These are 3 results, and they show you nice curvy figures. Thanks for watching this YouTube channel, and we'll try to make more videos to give more information. Take care.